So inconvenience is a number one reason I would say that folks tell me that they can't get their shingles vaccine. They're busy, it's hard for them to get to their doctor for a visit, their doctor's office may be far away, or they don't have time to take off of work to make an appointment. All these reasons are really good reasons. But consider this, if you do get shingles and you get post-herpetic neuralgia or you have some other complications, you'll probably miss work, and more than that, you'll be miserable because you'll feel pretty sick. And so even though it's pretty inconvenient, or it can be inconvenient, and we all understand why, there's a lot of inconvenience as well from getting sick with shingles. So if your doctor's office is far away and you can't make it over there for the shingles vaccine, you can call them and just ensure that you're cleared to get the vaccine. And then you can go over to your local pharmacy, and they're often able to give the shingles vaccine. So if you have the option of a pharmacy within your local grocery store that you can get the vaccine from, it's super convenient, and it might be the easiest way to go ahead and get it done because you're already there getting your groceries. These vaccines are given pretty quickly, and you know that you'll be going back probably to get your groceries in the time that you need to. If not that, you can try your public health office, which should be able to also set you up with some local clinics where you can get access to the vaccine. So we recommend for all individuals that they get their annual wellness exam, because that's the point where we as primary care doctors can check you out for lots of different things. We can do blood work, we can just make sure that you're okay. At that visit, we'll also talk to you about multiple vaccinations. You definitely want to ask your doctor, am I eligible to get the shingles vaccine and can I get it? The beauty of getting it at your annual wellness visit is that you're already there. And so they'll go ahead and give you the first dose, and then they'll schedule for you to come back in 2 to 6 months to get your second dose, and then you'll be all complete. I always tell my patients when I give them the shingles vaccine to just be ready for potential side effects, especially the arm pain. I always tell folks that they can go ahead and take acetaminophen the evening that they've gotten their vaccine so that they can just get ahead of any pain that they may have. And that should be pretty much all that you need. If you do get shingles, the severity of the shingles infection you will have is much less, and you can avoid having some of the complications of shingles like post-herpetic neuralgia, which is the kind of lasting nerve pain. So the benefit of getting the vaccine really far outweighs any of the risks that individuals may be concerned about.